To turn on closed captions, click the CC button. Welcome to the next generation of learner-driven next-gen training. This self-paced module highlights the new features that are visible throughout the application. Use the navigation bar at the bottom of the page to move through the module. When you are ready to begin, click the Start button. This module will include an interactive demonstration, practice simulation, and a short assessment to check your understanding. This module is intended for implementation specialists and clinical staff. Its focus is to educate you on the changes that occurred in the NextGen 8.1 upgrade. In this module, you will learn NextGen 8.1 upgrades for overviewing the Office Protocols workflow. For this module, you'll notice that most of the changes in NextGen 8.1 are cosmetic in nature. For example, a new button or different item location. While the look and feel might be slightly different, the functionality remains the same. As the module proceeds, any changes will be highlighted. To begin, click the appropriate Roll button in the bottom right corner of the page. In this example, we will begin with the patient Velma. Velma has type 2 diabetes. She was in the office today complaining of urinary frequency. On the TH Intake 814 template, scroll down to view the Orders grid. Click the Office Protocols button. The Office Protocols template opens. The tests on this template are Legacy Trinity Standard, and if written protocols exist, these tests may be done prior to the patient seeing the provider. An example of this type of diagnostic would be a urine dipstick. Often, clinical staff will collect a urine sample for any patient who complains of dysuria. Use the Office Protocols template if you have a written protocol in your office based on a patient's symptoms. Note, the new recommended workflow for 8.1 is to have users sort by the diagnosis column so that they can easily see what tests are associated with each diagnosis. Tests can be ordered from this grid based on the patient's symptoms. Click Diagnosis Description. This allows you to view the diagnosis descriptions in alphabetical order. Select hemoglobin A1C in the Order Set grid with the diagnosis description of diabetes type 2. Selecting a test in this grid will populate the Select Update Diagnosis fields. Click Place Order. Tests may have duplicate entries in the grid for multiple diagnoses. Best practice is to select the most appropriate reason for testing. Velma also had urinary frequency. Scroll down in the grid to locate urinary frequency in the diagnosis description. Order the urinalysis based on your written office protocol. In the second example, we will select Urine Dip with Micro, Automated. Click Place Order. The test now displays in the Today's Orders grid as ordered. Complete the order as you currently do in 7.92. Now that you've completed the interactive demonstration, it's time to practice. Review the scenario on the next page and perform the steps necessary to complete the task. If you are unsure of the steps, prompts will be provided after your second attempt to walk you through each step. To begin the practice relevant to your role, click the appropriate Roll button. Now that you have completed the module, it's time to take a short assessment to check your understanding. You must score 80% or better to successfully complete the module. For each question, make your selection and then click the Submit button. To begin, click the Start Assessment button. Congratulations! You have just completed this training module. You did not obtain the minimum score necessary to pass this module. Please contact your Regional Health Ministry Implementation Specialist or local implementation specialist for next steps. If you have additional questions regarding the upgrade to NextGen 8.1, contact your Regional Health Ministry Implementation Specialist or local implementation specialist. To close the module and submit your results to HealthStream, click the Submit Results button.